Elizabeth Holmes was 19 years old when she dropped out of Stanford to start her own company. She envisioned a device that would test for hundreds of health conditions and diseases from a single drop of blood. She would go on to found a company called Theranos dedicated to making that a reality. At her height, she became the youngest self-made billionaire, owning a 50% stake in her company that was valuated at $9 billion. She is now on trial for 9 counts of wire fraud and 2 counts of conspiracy to commit wire fraud. The journey from where she began to her dizzying success and eventual fall relied entirely on the feasibility of the science behind her invention and her lack of integrity and character that revealed itself as the technology repeatedly failed to live up to the promises she made to investors. While at Stanford, she spoke with one of the leading experts in the field of clinical pharmacology, Dr. Phyllis Gardner, who told her that performing tests using finger pricks wouldn't work because the skin as a collection site became contaminated with other materials more easily than intravenous draws, and it wouldn't provide enough blood to test without diluting it, which manipulates samples beyond the tolerances of most tests. If diseases could be tested for the same way DNA could be determined, by decoding a single cell, this idea may have worked. But diseases are detected in blood by measuring the relative amounts of proteins and hormones, and so just as in any statistical sample, accuracy requires a greater sample size. But Holmes had no medical training, nor any training at all that would be of use in the enterprise. Her use of the term microfluidics was more of a buzzword she used to talk over the heads of investors than a field of study she understood or ever implemented in Theranos' technology. She also named the containers for the blood that they tested nanotainers, because it sounds high-tech, though it had nothing to do with nanotechnology. She named the device that Theranos developed the Edison after the famous inventor. Despite the devices never producing reliable results, Theranos struck a deal with Walgreens in 2010 to offer testing services in 42 locations called wellness centers. Initially, Walgreens hired a medical lab consultant to vet Theranos' technology, and after Theranos drew the blood of Walgreens' pharmacy president, then refused to give him the test results, the consultant told Walgreens not to accept the deal, but they did anyway, fearing a competitor might strike a deal if they passed. During the partnership, some tests they offered in Walgreens used the nanotainers and the Edison, but many were tested using conventional lab testing equipment bought from other manufacturers and required full blood draws. The company was not forthright with customers or Walgreens about using conventional machines instead of the advertised Edison technology, but at least those customers got reliable results. The ones who used the Edison got wildly inaccurate results, as dilution of the blood samples was frequently necessary. One was diagnosed with Hashimoto's disease based on a bad thyroid test. Another was told she'd miscarried her pregnancy. All the while, Theranos offered the tests at affordable prices while frequently conducting them on conventional machines, which cost more money than they were charging for the services. Theranos was hemorrhaging money, but they had plenty of it. Theranos was able to secure $700 million in investments from the Walton family, Rupert Murdoch, the DeVos family, the Cox family, Partner Fund Management, an investment management firm, Carlos Slim, Greek shipping heir Andreas Dracopoulos, the Oppenheimer family, Riley Bechtel, chairman of the Bechtel Group, and Robert Kraft, owner of the New England Patriots, as well as $70 million more from shareholders through venture funds. Besides the promise of cutting-edge technology that would revolutionize healthcare, investors were impressed by Theranos' star-studded board of directors that included, besides Holmes herself and Chief Operating Officer Ramesh Balwani, former Secretary of State to Ronald Reagan, George Shultz, retired U.S. Navy Admiral Gary Roughead, former Secretary of Defense under Bill Clinton, William Perry, retired U.S. Marine Corps General and not yet Secretary of Defense, James Mattis, former Wells Fargo CEO, Richard Kovacevic, former Secretary of State to Richard Nixon, Henry Kissinger, former U.S. Senate Majority Leader Bill Frist, Riley Bechtel, who also invested $6.2 million in Theranos, and William Fagey, former Director of the Centers for Disease Control and Prevention. Frist was once a heart surgeon, but Fagey was the only board member with recent relevant experience in medicine and is credited with ending smallpox. As impressive as this board sounds to readers of Jane's Defense Weekly or Political Playbook, actual venture capital firms that invest in medical technology, including Bill Maris, the founder of Google Ventures, steered clear of Theranos because the board lacked sufficient medical expertise. Commentators have noted the concentration of older men who bought into Holmes' vision, so it may have been kismet that the Obama administration sent Joe Biden to tour Theranos' Palo Alto campus in 2015, who called it the laboratory of the future. Little did Biden or the press know during his visit how staged the event had been by Theranos. Employees attest that the room that had been used to display the Edison was a microbiology office just days earlier, full of old desks and computers. And the displays on the devices themselves were playing a pre-recorded video rather than showing actual data readouts. The press had been all in for Holmes and Theranos since an opinion piece by Pulitzer Prize-winning writer Joe Rago in the Wall Street Journal in 2013. Not long after, mainstream outlets were parroting Theranos' claims as if they were settled science. One article from Forbes was so effusive in its praise that Theranos included it in investor packets. To read the headlines, there is a clear trumpeting of Holmes being a woman, with frequent nods to her being a college dropout as well, further casting her as the Jobsian stereotype she wished to be, with her perpetual adornment of black turtlenecks and holding her larynx low to affect a deeper voice.
I believe the individual is the answer.
She was featured in glossy spreads in Glamour, Vanity Fair, and New York Times style magazine T. She had been featured on the covers of Fortune, Forbes, Inc., T, and Glamour. She'd made it onto Time's 100 Most Influential People list, as well as Forbes' Most Powerful Women list, Fortune's 40 Under 40, and was #1 on Business Insider's Silicon Valley 100 list, and was declared Woman of the Year by Glamour. She was interviewed on Charlie Rose, CBS This Morning, and Computer History Museum's Revolutionaries, and was featured in an American Masters documentary chronicling great modern women such as Madeleine Albright and Rosie Perez. She'd even gained the credibility of serious non-media institutions by becoming the youngest winner of the Horatio Alger Award, an honorary doctorate from Pepperdine University. She won the TechCrunch Crunchy Award for Best Health Startup, beating out Fitbit in 2015. She became a member of the Harvard Medical School Board of Fellows, partnered with the Cleveland Clinic, the #2 hospital in the United States, spoke to the Clinton Foundation, and gave a TED Talk at the annual TED Med event in 2014. Then, on October 15th, 2015, Pulitzer Prize-winning writer John Carreyrou of the Wall Street Journal published his bombshell expose about his investigation into Theranos, and the walls began closing in around Holmes. As the ship was sinking, the company unveiled a new device called the Mini Lab that failed to accomplish anything the Edison hadn't, which wasn't much. Besides the Walgreens customers who'd pursued affordable blood testing through Theranos' services, there was more collateral damage to follow from Theranos' deceit. Former Theranos employees have experienced hardship trying to find new jobs in technology and health sectors. Investors lost $600 million, including Rupert Murdoch, who sold his $125 million worth of shares for a single dollar in March 2017. Ian Gibbons was the chief scientist for Theranos, and despite battling cancer for the last years of his life, labored to realize Holmes' impossible vision of a device that could diagnose disease from a single drop of blood. He was subpoenaed in a lawsuit between Theranos and inventor Richard Fwees, and on May 16, 2013, the day before he would testify, he took his life, either because he feared what he might be compelled to say about the company and his work, or because he expected to be terminated by Theranos after doing so. Upon his widow informing the company of his death, she received a notice from its legal department demanding the return of his company laptop and any others of its property, and notably, no call or condolences from Holmes. In an agreement with the Securities Exchange Commission, Holmes will pay a $500,000 penalty, be barred from serving as an officer of a public company for 10 years, and will return the millions of shares she accumulated during the fraud, while relinquishing control of Theranos. Holmes has now been on trial for wire fraud and conspiracy to commit wire fraud since August 31st, after the trial was rescheduled once for her pregnancy and a second time because of the coronavirus pandemic. The government's case is that the founder Holmes knew that the tests produced by the company's invention weren't reliable, and that they willfully misled investors by presenting fraudulent studies about the accuracy of their device, that they used third-party commercial analyzers and passed off the test results as coming from the Edison, and inflated the value of the company to potential investors. Key witnesses were former employee whistleblowers, researcher Erica Chung and Tyler Schultz, an intern and grandson of George Schultz, a Theranos board member. Investors have testified that Theranos advertised its devices being used in U.S. Army medevac helicopters, which it wasn't, and also the documents were altered to include logos of Pfizer and Schering-Plough pharmaceutical companies to suggest to investors that these companies endorsed Theranos and its technology. Holmes on the stand blamed a rape incident for her dropping out of Stanford and has tried to shift the blame for Theranos' failures to her then-boyfriend and Theranos COO and board member, Ramesh Balwani, and has accused him of abusing and controlling her during their 13-year relationship. Holmes faces 20 years for the charges she faces, and a jury will decide her fate. There are several takeaways from this scandal. The average person likely doesn't know the difference between what kinds of technology exist or are feasible and ones that are pure fantasy. Just because internet connectivity can broadcast ones and zeros across the world instantly and provide us with information, entertainment, and the ability to communicate with anyone regardless of distance, doesn't mean that we can rewrite the human body to work the same way. And while it would be a great world if Elizabeth Holmes' idea could work, what makes an idea good isn't how useful it would be if it were possible, but how useful it will be because it is possible. And that may be the biggest lesson. All of us wanted Elizabeth Holmes to succeed. We wanted cutting-edge technology to improve health outcomes, and we wanted a smart person to come up with an idea that made our lives measurably better. And we wanted an ambitious young woman with seemingly the best intentions to be the source of that kind of innovation and show the boys that women can succeed in tech too. But we can't as society just will her into success to suit our preferences for social justice, because the only thing that will matter in the end is if the tech works, not how much we're rooting for her.